Shoulder arthrodesis. Indication is brachial plexus palsy, chronic infection, refractory instability, failed arthroplasty, and reconstruction after tumor resection. Contraindications: ipsilateral elbow arthrodesis, contralateral shoulder arthrodesis, uh, lack of functional scapulothoracic movements, trapezius levator scapular and serratus anterior palsy, Charcot arthropathy because it continues to fragment, elderly population, progressive neurological disease, poor bone block. Surgery can be done with the plating, single plating, dual plating. Position is 30 degree of internal rotation, 30-degree flexion, and 30-degree abduction. This is positioned to increase fusion area.